Thanks for staying with us here on TV5 News at 9. Right now, the healthcare industry is encouraging people to take charge of their health to live a longer and better life. Joining us this morning to tell us more, we have Angela Williams and Dr. Norman Chapin. Thank you both for being here.
Thank you for the invitation.
Of course.
Thanks,
so, Angela, we will start with you. June is Men's Health Month, and we observed Women's Health Month in May. Why are these national campaigns so important?
Well, these are important because of the fact that we want to remind the community of taking care of your health and prioritizing your health. So not just prevention, but annual screenings, self-checks, including your families in your goal of taking care of your health.
Right. Always an important reminder, too. Dr. Chapin, why is it important for both men and women to take part in regular screenings, regardless of age or symptoms?
Well, I think there's really 4 reasons that we like to focus on the screenings. The first is that early detection is critical. The earlier we recognize that a person has a problem, the earlier we can intervene. And so that makes it much more likely that the patient will benefit from the treatments, that the treatments may be less costly if the disease has not progressed. So preventing disease progression is number 2. And I think screenings also contribute to maintaining a person's quality of life, and they just help us create a good risk profile for the patient so that over the ensuing years we can provide them with the best recommendations for their health.
Something could be wrong and you may not feel it right away or see anything right away.
Yes,
so early detection is key, for sure.
But I would like to, I think too, and Angela mentioned the prevention aspect. I mean, I think the first thing that people can do is stay healthy, and prevention is critical to that strategy. We think about a healthy diet. We think about never letting your BMI or your weight exceed certain thresholds, which from the BMI perspective is 30. We like to see everybody below 30. Physical activity is fabulously important and tremendously important, I should say, for both cardiovascular health as well as cancer prevention. A lot of exercise regimens have been shown to reduce even the incidence of certain types of cancer. So prevention first, appropriate screenings and monitoring is very important, following up with that.
Definitely. Angela, what are some of the most common health issues women face, and what are some of the vital screenings we should all be receiving?
So heart disease is number 1. Number 2 is breast cancer. So heart disease, not only your heart, your high blood pressure, diabetes, heart attacks. So having those annual screenings can detect something that you may think, oh, I have a headache and I feel okay, but it may be detecting something else. Breast cancer, there are familial histories of breast cancer, but at the same time, having your annual mammogram can detect whether or not you are diagnosed with breast cancer. But early prevention is the most important, as well as having your reproductive health screenings and your dental, your mental health screenings. Those are equally as important as everything else.
All very important. Dr. Chapin, why is it important for men to receive yearly checkups, and what are some of the common health concerns men face?
So I think it's important for the reasons that we've talked about already to get health screenings for men. And men face many similar challenges and diseases that women do. So heart disease, diabetes, obesity, hypertension is a big problem for men. And then specifically, whereas we worry about women with their bone density, breast cancer, colorectal cancer screening, for men it's lung cancer, colorectal cancer screenings, and prostate cancer, of course, which you really should have a standard approach to each of those disease processes and screen for them properly, beginning between the ages of 40 and 50, depending on the condition.
I mean, I know it is so hard to get my husband to go to the doctor. It seems to be a really common trend for a lot of men for some reason. How can we help men feel more open about discussing their health concerns with their primary care provider? And how can we get men to visit the doctor more?
Well, I think one of the most important things for men is their significant other, their wife or spouse, partner, because a lot of times that does motivate us to have conversations. Historically, we've seen that men tend to be in a denial phase for a little bit longer than women, and women enter the healthcare system for a variety of reasons at a much earlier age than men do. So I think it's important for the community to understand how important it is for men. I think all healthcare providers should have a very aggressive strategy to reach out to the men in their practice and remind them about the importance of it. And I think through community education and awareness within organizations that employ men, I think we can create a better understanding in the community of how important it is for men.
Definitely. And Angela, how can we help people understand the importance, once again, of going to the doctors, getting checked or getting screened, especially if they're feeling hesitant or unaware of something going on with their body?
I thought about this question this morning, and take a trusted partner. It could be a friend, it could be your spouse, or someone. If you're feeling uncomfortable or fearful of doctors, Dr. Chapin is a physician, take someone with you, but don't walk out of that office without having a clear understanding of what the doctor is saying. And when I do these monthly features, I always emphasize the importance of understanding what the doctor is saying. Bring a notebook or bring a piece of paper. So challenge Dr. Chapin and say, Dr. Chapin, I don't understand what you're talking about. Can you say it in clear language? Because it's difficult to absorb information, especially if it's a possibility of it being some negative information or a surprise diagnosis that you didn't think that you had, but you want a better understanding. And also, don't rely on social media. If you're going to just try to find out more information about a specific health illness, go to credible websites, not just Facebook or someone saying information that's probably not credible. But the most important is to prioritize your health and have a good understanding of it.
Yeah, TikTok is not your doctor. No. Remember that. Well, any other reminders you would like our viewers to know today, either of you?
Yes, I need to remind people that Great Lakes Bay Health Centers is always accepting new patients. Whether you have the ability to pay or not, we accept Medicaid, Medicare, as well as if you have no insurance, we're able to assist you with applying for health care insurance if necessary. In addition to that, it's important that everyone gets screened for their vaccinations. From babies to adults, we offer COVID vaccine, RSV, flu vaccines, but keep up on your schedule for your vaccines is equally as important.
Definitely. Dr. Chapin, anything else from you?
No, I don't have anything else. I think Angela's covered it well.
She covered it.
Yes.
Well, thank you both so much for being here. We appreciate your time.
Thank you
for having us.
Of course.
Thanks.
As always, you can still find more information on today's topic by going to our website. Just go to the hot link section on WNEM.com.